I'll be honest with you, there are plenty of mistakes people make with their knee replacement surgery, but the most common mistake that I see also happens to be one of the most dangerous. Here's what I mean. Your surgeon is really in control for only about 2 hours when you're in the operating room, but the months before and the months after, the person who's truly in the driver's seat is you. In other words, knee replacement isn't something that's done to you, it's something that's done with you. And that's exactly why the #1 knee replacement mistake there is not realizing how much of the outcome is in your own hands. Now, I know that sounds like motivational fluff, but it isn't. By the end of this video, you'll see exactly how serious this mistake can be and how it derails your knee replacement in ways you wouldn't expect. The good news is, avoiding this mistake doesn't take anything special. It's a set of specific actions that anyone can do. I'm Dr. George Bounajem, Dr. B for short, and I'm a Harvard-trained, board-certified orthopedic surgeon who specializes in hip and knee replacements. There's no doubt that having a skilled surgeon and good physical therapist is crucial for your success, but I'm about to show you how you are the most important member of your recovery team. Let's get to it, starting with what you can control after surgery. The first and most important is doing your rehab effectively. Most patients know that physical therapy matters. That's not groundbreaking. But what many don't know is what actually makes physical therapy work. There are 3 pillars of effective rehab after knee replacement, and if even just one of them is missing, it all comes collapsing down. The first pillar is timing. I'll let you in on what many patients wish they knew sooner. There is a shrinking window of opportunity after surgery where the biggest improvements in your knee's motion can be made. For most people, that's the first 12 weeks, but especially the first 6 weeks. Once that window closes, motion becomes harder and harder to get back. That's why starting rehab early and staying on schedule matters so much. Delays in starting create an uphill battle for you by allowing the scar tissue and stiffness to get ahead. But showing up on time only gets you a third of the way there. What you do when you show up is just as important. That's why the second pillar is intensity. I'll be direct with you. Gentle, comfortable movement isn't enough. Severe pain generally should be avoided, but discomfort is actually a sign that you're pushing your knee to adapt. If you only exercise within your comfort zone, you give your knee no reason to improve. For many patients, a more challenging, strength-focused approach leads to better function than gentle therapy alone. Pain is something that everyone experiences differently. So if you think you're pushing too little or too much, your physical therapist and your surgical team can help guide you. But even perfect exercise won't help you if you only do it when you feel like it. And that's why the third and final pillar is consistency. Having a good physical therapist on your side is so valuable, but sessions with a physical therapist might happen 2 to 3 times a week for an hour at most. That's such a small fraction of your total recovery time, and it just isn't enough to get the most out of the surgery. The patients who make the most progress are the ones who don't just go to the physical therapy sessions, but who also do their home exercises consistently between sessions. It's like learning to play the piano. A weekly lesson won't get you far if you never touch the piano on the other days. The progress happens in the practice, not just the lesson. Timing, intensity, and consistency. All 3 matter, and all 3 work together. I have an entire video series on how to unlock the most motion you can out of your knee replacement, and I'll put a link to it in the description. But here's the thing. Even with perfect physical therapy, there's a mental trap that catches even the most motivated patients off guard. Fortunately, you have the power to avoid it, as long as you know what to look out for. And that trap is comparing yourself too closely to others. I know that sounds like a tired cliche that couldn't possibly impact your recovery, but let me just paint a picture for you. Let's say you run into your neighbor 2 weeks after surgery, and you're still using your walker. She casually tells you that she never needed a walker to begin with. Or you find out that your friend who had surgery 8 weeks ago is back to playing pickleball in his league. But then you get to 10 weeks in, and you haven't even touched your paddle yet. The doubt starts creeping in. You naturally start to wonder if you're behind and if something's wrong. And look, every single knee replacement patient, at some point in time, has wondered if they're on the right track. But too much comparison is more than just frustrating. It can actually set you back. If you feel like you're falling behind, you're more likely to push harder than your knee is ready for in order to catch up. And that can trigger inflammation, which is the exact setback that you're trying to avoid. The discouragement also slowly drains you of the motivation to keep doing the work. The truth is, every single recovery is different. The same patient can have the same surgeon perform the same surgery on the left and right knees, and you would think that the recoveries would be identical, but that isn't usually how it is. One knee often recovers faster than the other. That's how much individual variation there is. And on top of it all, When you compare yourself to someone else, you're often not getting the full picture. You don't know the condition of their knee before surgery, differences in their anatomy or medical history, or even if they're being totally accurate about their timeline. Now, if you're having concerns, you should absolutely talk to your surgical team. I'm not saying to ignore what you're feeling. What I'm saying is that the natural tendency to see where you are in recovery can go too far. The only person you should be repeatedly comparing yourself to is the person you were last week. So that's after surgery. But believe it or not, much of your outcome has already been shaped before you even enter the operating room. What I mean is that what you do before surgery matters just as much as what you do after surgery, and I'll show you exactly how. I have dedicated videos on several of these topics, and you can find the links to them in the description. But let me walk you through the key areas so you can see the full picture. Here's one that surprises many patients. What you eat or don't eat can actually increase your risk of developing complications. Most people associate nutrition with general health, but your nutrition has a direct impact on your knee replacement outcome. For example, low protein, low vitamin D, and low iron can lead to more muscle loss, higher infection risk, and longer hospital stays. These are things that can be corrected before surgery, but in order to fix them, you have to know that they matter in the first place, and that's what makes them so easy to miss. So your nutrition before surgery is a big deal, but what almost no one talks about is mental preparation. And just like after surgery, the mental approach before surgery is just as crucial, probably even more so. People who go into surgery with anxiety and depression report more pain and worse function a full year after surgery, even when the surgery itself had no complications. Studies have shown time and time again that mental health has a very real, very tangible impact on outcomes. Recovering from knee replacement is as much a mental game as it is a physical one, but the mental effect actually isn't all bad. Studies also show that when recovery after surgery matches expectations before surgery, patients are most satisfied with their results. In other words, having the right mental approach beforehand leads to the highest levels of satisfaction after knee replacement. Here's the bottom line. Your mental state isn't just how you feel. It's a factor that directly shapes your recovery. Thankfully, it's something you can work on. If you battle with anxiety or depression, talk to your surgeon about it. Have an honest discussion about what to expect after surgery, not just in general, but for you as an individual. Both of these conversations make a genuine difference. Now, mental preparation is important, but your physical state is one of the biggest drivers of your recovery. This is where Prehab comes in, which is really just short for preoperative rehabilitation. Prehab is targeted exercise in the weeks before surgery to help improve strength and mobility. The concept is simple. The stronger and more mobile you are going into surgery, the better your starting point after surgery. Studies show that prehab for 4 to 6 weeks before knee replacement gives patients an advantage in the early weeks of recovery. And the patients who tend to benefit the most are the ones who have the most room to improve. That means that if your mobility is especially limited, prehab could be even more valuable for you. The good news is, it doesn't have to be complicated. Exercises you do at home, like quad sets, heel slides, and straight leg raises can make a big difference. A nice bonus is that you'll be doing these same exercises after surgery, and they're much easier to do when your body already knows them from prehab. But no matter how prepared you are physically, you can still run into problems if your home sabotages you. You heard me right. Your home itself can actually be one of the biggest dangers to you if you don't prepare carefully. Half of all falls after knee replacement happen at home. Patients often think it won't happen to them, but the surgery and pain medications both increase the risk of falls. Your loose rug, low toilet seat, and slippery bathroom floor are all real threats to your recovery. Fortunately, most of this is completely preventable. Clearing your pathways, installing grab bars in the bathroom, and using chairs that seat you high enough all help prevent a bad fall. The patients who have the smoothest recoveries are the ones who treat home preparation like it's part of the medical plan, not as something that they'll just figure out after surgery. Now here's the thing. We still haven't covered one of the biggest ways you're in control of your knee replacement outcome, and that is how you treat your medical problems before surgery. Now, I know you're thinking that you've heard this before. Every overweight person has been told to lose weight. Every smoker has been told to stop smoking. And let me be honest with you. Doctors like myself often need to do a better job of not just telling patients what to do, but making it easier for them to actually do it. That's where we can improve. But let me run through this at a high level, because the truth is, it does affect your outcome. So it's our responsibility to make sure you know how to help yourself. Obesity, diabetes, and nicotine use are 3 common and crucial medical factors before knee replacement. All 3 significantly increase the risk of infection, which is one of the worst complications a patient can face. To know what goals to shoot for, we first have to know how these factors are measured. Body weight is often measured in terms of BMI, which stands for body mass index. This is calculated by dividing your body weight in kilograms by your height in meters squared. For diabetes, a common marker is hemoglobin A1C, which measures how well blood sugar was controlled over the past 3 months. There's no perfect A1C or BMI before surgery, but many surgeons recommend getting A1C below 7.5 to 8% and BMI below 40. And when it comes to nicotine, stopping nicotine use 4 to 6 weeks before surgery helps to lower your risk. Like I said before, we surgeons need to be better at making it easier for patients to reach these goals, and referring you to the right medical providers is often the best way to do that. Depending on where you live, specialists for diabetes management, weight loss, and quitting nicotine may be close by. And of course, your primary care provider is always a good person to help you with these as well. We've covered a lot of ground on this one, so let's do a quick recap on everything you have control over. After surgery, the rehab pillars of timing, intensity, and consistency, and even the way you think about your recovery, shape your outcome every single day. And before surgery, your nutrition, mental readiness, physical conditioning, home environment, and medical conditions all play a direct role in how your knee replacement goes. Taking control of these is what lets you avoid the most common knee replacement mistake there is. All of this can seem daunting, but look at it this way. The fact that you're here, that you made it to this point in the video, tells me you get it. You're not just waiting for surgery to happen. You realize that you are the most important member of your own recovery team. I'll put my video on my personal top 8 exercises for the first 6 weeks after knee replacement right here. If you found this to be helpful, consider clicking the like button and subscribing to the channel. It helps other people find this information when they need it. Stay well, and I'll see you in the next video.